Hey folks, we're back. I'm your host, BKP. First and foremost, thank you, North Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. We want to welcome Dr. William Whaley and Dr. Raymond Tidman. And as you well know, I think it was around 1 a.m. this morning, a tweet went out from the President of the United States acknowledging that him and his wife, Melania, our President, both and First Lady, have both tested positive for COVID-19. Now, there's a lot of spin going on in the media, but we're going to get right in with our doctors. And it's interesting, a viewer last week sent us a question, and this is going to fit to open our discussion about the President. And our viewer asked, what drugs are good for fighting COVID, or do we just wait for a vaccine? So we're gonna push that into what we're talking about with the President. But as a doctor, okay, tell us.
You're not going to ask me about throwing away all my previous notes.
Exactly. He goes in this one with all these notes
pages,
and he said, "Well, I guess this changed."
I got amoeba brain eaten. I got data on positive tests in Croatia and everything. We're not going to get to.
Okay.
I want to say first of all.
Go ahead, sir.
Say first of all, the tie.
Yes, sir.
Is a flag tie for the Commander-in-Chief and a Bible at the bottom. So when people will say we pray for the family and the victims, I think we pray in my house every day when we have dinner for the President, his family, and our country. So we continue doing that. But I want to make it very clear. The President isn't sick. I mean, why in the world is everybody getting their what do they say, panties in a wad or something? The President has a positive test. 96% or not, I don't know number, Ray, pull it out of your face. 96% or 98% of positive tests are positive blinking tests. For the next 10 days, he's going to sit around and he's going to govern. Think about Putin. Putin is living at the end of a 15-foot tunnel that has ultraviolet light. He's doing everything by video except with the family, but nobody in the world really knows that Putin's in this bubble. He's just out there governing like crazy. The President can govern from everywhere in the blinking White House. I mean, he's got a bowling alley in there, and he's got the crisis room in there. He's not going to be stuck in a 4x4 cell. So all you're not going to see is you're not going to see him out there in an airport in Iowa or Michigan or wherever he was going next for the next 10 days. I don't expect him statistically to get ill.
Okay. Okay. No, I want to stay with that a minute, because you're right, Dr. Whaley. I appreciate it. You did so much research on some other things and questions that we have that we were going to cover, and this changed things up. The media, I started watching this morning, and the media is already treating this as, who is the President okay? What's the next step? What did you think when you heard the President tested positive this morning?
Of course I'm worried. You know, he's in the perfect group. I mean, he's a elderly male, that's slightly overweight, that, you know, is in the group where 4% of those people get taken out. Now that's only 4%. I mean, 4% sounds like a small number to the public, but 4% is a big number in medicine. Okay, and if everyone was hit with 4% death rate, it would have been the millions and millions of people killed. Okay, but he's in that special group. The thing that I'm so annoyed about are the people who immediately jump in on this. I'm starting to call them the branch Covidians. Okay.
Branch Covidians,
yeah, like
that's
the branch
good.
Davidians, the branch Covidians. I mean, they got a whole.
I like that.
Ritual.
Coin that. Write that one down.
Branch Covidians, that's a good one.
They're like they have this whole ritual around this. You know, if you wear a mask and if you do this and if you do that, then you will not get the virus. Okay, it's just like this cross in front of vampires. People are going to get the virus. There is no perfect treatment. There is no perfect protection.
Yeah, let me.
And this whole notion that you can stop the virus total, and when we get rid of the virus totally, that everything's going to be okay. That's not going to happen.
Yeah, let me get to that, because we were discussing this earlier. I have a patient and friend who was with the president last week, whatever day he was in.
Thursday or Friday, he was in France.
Okay.
He was in Atlanta.
All right, so now, and when I say with him, he was with a group of 8 or 10
Right.
people that met with him, but he had to be tested. He was tested the day before, he was negative, and he was with the president. Now, we know the president was negative on Tuesday, has tested every day. It's negative on Tuesday, everybody in the White House is negative, everybody's tested every day. You want to say, where did the president get the virus? Well, 40% of the cases that are out there are with no known exposure to anybody who had the virus. And when Ray says that, you know, the virus is going to go away because I'm wearing a mask and washing my hands, that's a myth. And we know he wasn't at the supermarket pushing a cart around.
Right.
He is probably the most protected person in the United States. I can't imagine anybody else more protected unless they're in a bone marrow transplant unit or something. So basically, he's been in a security bubble with the Secret Service for terrorism, and he's been in a medical bubble where everybody that's gotten near him has been tested negative. And everything about the airplane and the limousine is cleaned up every 10 minutes, you know, and yet still that came somewhere. Well, now did that come off that stage where they were with all those people? I mean, I don't know, and I really don't care. But it does emphasize the fact that 40% of these cases are coming from asymptomatic people that you don't know because you don't know wherever it came from. So is it coming out of the ether some kind of way? I don't know. Secondly, he isn't sick. And he might run a fever this week. When Boris Johnson got sick, got the virus, he wasn't sick for 8 days. He ended up going in the hospital, and they got treated. And that brings me to the questions that they were asked, and I'll come back to it in a minute. But you would wonder, this morning, are the president and his wife taking hydroxychloroquine, zithromax, and zinc?
I bet you they are.
And because of his previous statement, I would bet you they are. Now, because of the National Institutes of Health, the ability to get to the remdesivir and all the other antiviral agents, I would imagine that they are on an antiviral agent. And other than that, I think they're having breakfast this morning.
Let me stick with your train of thought there, Bill.
Yeah.
Because I guess one of the other things that annoys me is that, and I use this sarcastically about the Branch Davidians. People who get sick are not bad people. They're not dirty people. They're not wrong people. The ones that get sick, they're going to have to go through this and get over it. He is not sick yet, and hopefully he won't get sick.
He won't get sick.
And they'll watch him like a hawk. But the most important thing, I think, is that we need to be kinder to each other. We need to be more empathic to each other, and we need to get this whole illness thing out of politics. It's disgusting that there are people that are politically using COVID. People blaming Trump for the virus. People saying Trump didn't do a good enough job. That is just disgusting to me. It's disgusting, and it's just not like our country. And so now there's going to be an opportunity today to see how some parts of the media put their little digs in. He wasn't wearing a mask, or he's not in the mask wearing group, or he didn't make them wear a mask enough, or he's not making everybody wear a mask, therefore he's not a good person. It just needs to get away.
I got to change it up a little bit because I want to go to this. I want the people out there now. You're treating COVID cases. You have treated COVID cases. Okay, so here's what I want to do. I'm going to give you the scenario, okay? So, Dr. Tidman, take this as a physician that's been directly treating these cases. Be the White House doctor for a minute for our people out there. Take us through what you think has happened with I've read what the White House doctor has said, but take us through of when he became positive. What do you think are the first things they did? What will they watch for?
Well, as Bill said, they're surveilling everybody every day. They surveilled an aide that's close to him, probably in and out of either his wife's presence or his presence hourly every day. Okay, she's positive. They immediately test everybody. They find the president and his first lady.
But they test them every day anyway.
Every day anyway. But because she was positive, they immediately went to the most contact. Now they've gone and they've tested the Secretary of State. He's negative.
Right.
Secretary of Defense is negative. The Vice President and his wife are all negative. They've all been tested last night, and they're all negative, okay? So this has come in as almost all the cases that we are able to contact trace into the home from a person that's fairly close and regularly in contact with somebody.
But
for a prolonged period.
we know was negative the day before
Yeah, it was
because they're
negative the day
tested
before.
every day.
So now the other thing, we don't have any science about masks. We have empiric data. And the empiric data says that when you wear a mask, the more often you wear the mask, the less the cases are,
And that's
usually
true.
the less severe they are.
And that's true.
Okay? So hopefully this is, even if he got sick, a less severe case because his inoculum would have been less from the mask wearing. And that's all empiric data. That's not concrete data. That's not placebo-controlled trial data, okay? So, yeah, I think that they're obviously sequestering them so that it doesn't leave the first
The White
couple.
House, yeah.
Right.
And that they will aggressively treat him with whatever medicine is out there, and he'll get the best care possible. So,
But to be clear for our viewers, there's a difference in testing positive, you are positive, and being sick.
Okay, let's stop right there because that first question comes to this. This
So
came
what
to
is-
me-
that's where I wanna
All right,
go
so
with
yesterday, a person that we are very close to tested positive, and their physician, who is in the Riverstone practice up there, we discussed with this person's permission, they're not sick. Would you give them hydroxychloroquine, zinc, and Zithromax? And the physician says there's no data that this works, and I don't do it. I said, fine. Now, we discussed here before that it isn't going to hurt anybody.
Right.
And that in an abundance of caution, Ray and other physicians that are in this position and some in my practice are giving that cocktail immediately upon positive testing in some patients. They wouldn't give it to a college kid.
no, I wouldn't give it to you.
They wouldn't give it to a college kid, but they'll give it to a 60-year-old person who's got chronic lymphocytic leukemia or something. So the answer to that question is there is no drug known to be effective taken now that diminishes that will lower the incidence of the illness progressing. Period. Now, all these clinical trials are going on, and there may be some evidence that remdesivir might do something, but it isn't a magic fix.
And the
But
remdesivir studies are in inpatient studies now. There
Yeah,
is a
not-
big study that's just rolling out. That
Oh,
says,
that's at this stage, and it might in 6 weeks or 6 months tell us something. But if I was the White House physician, I'd have him on everything we know. You know, I mean, I'd call my mom and I'd get him some of that. You got some sauerkraut.
Yeah.
We got sauerkraut down here for another patient. You're gonna come up in the next statement, and the chicken soup, and the vitamin C, and the prayer and laying on of hands, and everything else we know might be a benefit because it's President of the United States. That's the reason that the CEO of huge companies get these massive preventive medicine physicals every year, and they get colonoscopies every 2 years and do all of these things for which there is no medical data that it's cost effective because they don't want them to get in trouble. Now, if you will watch the Netflix series on the Challenger, you'll see what they do to those astronauts. They get ready to send them off for 4 days or 6 months up in the sky. I mean, they give them so much preventive medicine and testing and everything else because they want them to be 100% healthy. So take that philosophy to the President of the United States, and this morning I would guess that he's on the acyclovir, he's on the hydroxychloroquine, he's probably on remdesivir, and on the chicken soup and everything
Is that
else.
what
So
you
I'm
would
gonna
have
be-
prescribed?
Yeah, so let me be clear about that. If I have an at-risk person who presents to me and I'm in the first 5 days of positive test or symptoms in positive test, they get the triple therapy from me, okay?
Right.
Now, the net of all studies, to my read, says in that group of patients it is beneficial. It's not a controlled trial.
We know it's not harmful.
We know it's not harmful. So it's not a controlled trial, it's not a lot of people, but of the 3 people in my practice who have gone into the hospital and been on a vent, 2 got the triple therapy and survived. 1 did not get the triple therapy and died. We've only had 1 death in my practice, and it didn't get it. Now, that's meaningless. It's tiny data, but I'm just reinforced in my practice. And let me tell you, unconsciously,
Of course,
those things
now,
matter.
go back, the number of people who go on the vent who survive is
small.
about, well, no, right, now it's up to about 20%.
Yeah.
So if he had 1 out of 5 that died,
they're
so anyway,
still
1 out
they're
of
in the
3.
random numbers.
All right, so
that's
doctor
random.
comes in, and doctor comes in, Mr. President, you tested positive, and he says, what do you mean? I'm sitting here watching TV, I feel fine, I'm not coughing and not wheezing, and what do you mean? I feel fine. What happens next? You go ahead and prescribe the cocktail to get out in front of it?
I
Go
would,
ahead.
but you know, that's an individual doctor's choice.
Right.
As Bill is
With the
we're
patient.
pointing out, it's a doctor-patient relationship, okay?
What are we hearing this morning? Are we hearing he's got COVID and sick? Are we?
No, he's
No,
not.
he's
he
not
has no
sick.
symptoms.
Nobody says he's sick.
Right, I got it.
No
Okay.
symptoms, 0.
He
All right.
tested positive.
Right.
Period.
So let's tell them out there. People are wanting not to switch it.
I started
politically,
out
but
by
we're-
saying 96% of the time, I don't think he's going to get
In trouble.
sick or bad sick. He might get a low-grade fever. He might feel like he wants to take a nap. But I do not anticipate. Now that's not what happened to Boris Johnson. Boris Johnson got sick enough to go in a hospital. But if you look at these other presidents around these countries, Brazil, Italy, Bulgaria, I don't think any of them ever got in a hospital.
So we don't want to sound the alarms.
No.
And but they're sounding the alarm.
Well, not only are they sounding the alarm, the stock market dropped 400 points on this news.
Right. So I understand that. I got it. That all the alarm bells are going off. But in reality, like you said, now there is concern. He's 74 years old, which puts him in the age group that is the highest risk.
Right.
And he's overweight, a little overweight. So those 2 factors are things that his doctor is watching for, and there's a little more concern. How long's he in for? So
10 days.
10 days.
days.
Yeah,
That's
it.
Is it 10 days after he tests negative?
No, he's got to
or-
have 3 days of no fever, no symptoms within that 10 days. Now, that's also pushing it out there. They'll be testing him every day going forward. Even now, they'll be testing him. So
But the point is, he might be positive for 60 days, as you know. When people get well, they have low-grade tests. I spent some time with Dr. Marlowe. We're not going to talk about tests today, but when you get a test, which these people, a lot of these tests that we're seeing are positive, are meaningless because the way the PCR has to be enhanced, they get up to 37 magnifications of it before it becomes positive. Well, that means there were so few viruses there that they probably are clinically meaningless, but they call that positive.
That's a very good point. There could have been a dozen viral particles there, which won't make anybody ever get sick, but they'll amplify that 30-fold.
37-fold.
37-fold.
You can go up to 30 and be good.
That's a positive test. Yeah, there was a little.
What does
few
it
viruses
mean?
running
Yeah.
around. It means nothing. The test is, Dr. Marlowe doesn't like me saying this, but the test is overly sensitive because it is so sensitive. Okay, it is so sensitive that we don't really know, is that person going to get sick, but we do know that the virus has been around them. Okay.
All right, well, let me ask a question that many are out there are wondering, and I've already listened to several in the media trying to take on these areas. I'd rather hear from you 2 doctors. They're going through the whole list of people. Now, Hope Hicks, his assistant, tested positive first. They're going through a whole list of everybody that's been around him. Is there concern from the debate Tuesday night?
No. Let me jump on. There's something more important layered in what you just said there.
Okay.
The lateral flow test that's coming out. So the president has been getting tested every day with whatever technology we need.
Right.
The lateral flow test that's coming out will give the American public access to this level of testing. Okay, you can be damn sure that no one is going to get the virus from the president and the first lady. They identified them, they quarantined them. Okay, so that virus is whatever it's going to do, it's gone, it's done. Right. When the rest of the public has this lateral flow test, that level of scrutiny will be available to the American public. And it will be as meaningful as the vaccine will someday. That if people would get symptoms or be around somebody or be worried, they test themselves, they're positive, they quarantine. Then that's a dead-end street for that virus.
Stops it.
Stops it right there. So, I mean, that's the other unspoken side of what's happening today, is that level of testing and that ability to quarantine the person that now may be the carrier stops the virus.
And that may be
Right.
more important than the vaccine, because one of the things, put up the one video we've got there. When you talk about reliable or unreliable sources, this is the director of the National Institutes of Health. It's his daily blog, and I think I showed this to you. Oh, I sent it to you, BKP.
Yes.
Study finds that people have short-lived immunity to the seasonal coronavirus.
Right.
So this study has blood from a group of people going back to 1980 that has been drawn every 6 weeks to every 3 or 4 months since 1980.
Right.
Okay? So kind of like Lance Armstrong had a bunch of urine in the freezer when they finally invented a test that would allow them to test for erythropoietin, and then they went back 9 years and found out he'd been cheating, took his license away. So it's same sort of idea. This has all been in a freezer since 1980 at every 3 to 6 months. Now that they've got some pretty reliable tests for the antibody, not just the general test that's out there, there are 6 known coronaviruses that have been present for the last 40 years that cause illness. SARS, MERS, common cold. So they have gone through those bloods and have tested them at intervals and discovered, okay, in 1996, this guy got, call it COVID number 1, had an antibody to it. Whether he was sick or not sick doesn't make any difference. The antibody, and many of those people were reinfected with the same virus 1 year to 18 months later, indicating really that the immunity is not lifelong. Like when you get a measles shot, it's supposed to be lifelong. Well, that's not antibody. And flu shots are not but a year. So it's quite probable that the coronavirus that we now have, don't know the answer yet, will not have long-term immunity. So that's the first issue. Second is, we already know and have discussed here before that there are people who have had the virus, they have recovered, they shed the virus for 60 days or 90 days, and 140 days later they can get a second infection. It's always less vigorous than the first, so there's some degree of recall immunity. So the idea that a vaccine is going to be like Lazarus dipped in the blood, I think is fallacious. What Ray says is, when you've got the virus, you get sick and you go hide for 2 weeks or 10 days, you killed it off. And that is probably on the long term, on the short term of the next 24 months, as important
as the vaccine,
if not more important. Because right now I'm going to quickly do this one, so I won't feel like I've lost everything here. But 296,000 people in the United States were tested for the COVID virus over a 2-week period. And the number of positives that were present in African Americans was 10%. Now this is up to last week. Hispanics 11%, and in Caucasians 4%. So even now, this late into this illness, this is the same kind of numbers you got from New York City back in March when they went to the Costco and tested everybody that came in the door. That was 10%. So that number hasn't gotten a whole lot better. You would have thought that by now, if it was 10% at Costco in March or April in New York, it'd be 15 or 20% by now. It isn't. That's
All right, let me move this with what short time we have, because there's a couple.
Oh, we got lots of time.
no pressure.
See the expert panel over there.
All right, so all right, moving right along, but so let's say this. There's 2 things I'd like to discuss with the audience. all of these open air events that have been held with thousands of people, we now have states that are, Florida is completely taken any restrictions off of bars, restaurants, and so forth. We have states that are reopening. Is this a setback to that, or is this a concern?
No.
Absolutely not.
No.
Okay.
And New York State, or New York City, either New York City, New York City, the kids went back to school today. Kids didn't go back to school today half a day, half virtual, half kids went back to school today. The kids went back to school today.
So
That's
let me
big
tell
deal.
you how but that's way late. I mean,
Oh, yeah,
the county that Manhattan
has
had like no deaths for.
Yeah, but
for a month.
we've got states where the people, whole states where the kids haven't gone back
So
to
if
school.
the media tries to spin this and we have to freeze everything, we have to stop.
Nice,
we have
that
to,
would be a
we have to-
ridiculous step.
That's crazy.
But it's going to be said, we have to take another look. Does this change the way we approach
How many
it?
people is Disney laying off?
60,000.
Humongous
American
number.
Airlines
and that's
and
California
United
shutting down
Airlines.
Disneyland, not allowing people to go back to their lives.
Right.
Lots of people losing their jobs. Okay, that will have more deadly effects on families, on destructions of wealth and livelihood than California COVID cases.
Or wildfires. Well, we heard last night that half the bars and restaurants in Manhattan will never reopen.
Yes.
Never.
150 fitness centers in New York City went bankrupt.
I used to be a stockholder in that. That's the New York Health Club.
I mean, a fitness center is where you go to get healthy. Now they've bankrupted fitness centers where you go to get healthy over stupidity.
So if the doctor says, I've heard this somewhere before, I don't know, but if the doctor says, you could really manage if, with this medication and proper diet and exercise.
Yeah.
Yeah.
They just
Somewhere I've heard that.
They just
I don't know.
They just
Maybe
took
your
your.
grandmother told you that, don't smoke, get 8 hours of sleep
Right.
at night, exercise, study.
So
Eat your spinach.
Eat your spinach.
Proper, now we're fortunate enough, and I know we don't take it for granted. We really don't, because we love it. We're fortunate enough. Exercise for us in North Georgia, we could get out and take a hike. We could do that.
Yeah, my
But
motto, go outside, stay alive.
But a lot of people do live in areas where the treadmill is there getting out.
Yeah.
And you know what I mean?
Well, and the social
Correct?
aspects. Look, when you,
treadmill, walking,
when
going
you-
in,
when-
riding a bike.
but when you go to a fitness class, I mean,
Right.
this really is some of the only social activity housewives and mothers have is going to their Zumba class
I
with
get
some
it.
of their friends.
I get it.
And they shut down the place. They can't go to Zumba class. Their self-image goes down, because your self-image, when you're fit and you're interacting with other fit
We're
people, you
social
feel.
creatures.
Yeah, but that your self-image goes down. Then you drink more liquor. Then you fight with your husband. You get divorces. I mean, it's a mess.
Statistically, this is a disaster on some areas. All right, look, we can't leave without this.
All right.
Because, daily I watch the media every morning, and I watch it from their side to see what they're trying to present. They're trying to move us into the second wave. Supposedly, Wisconsin is in the second wave.
Yeah, I saw that this morning. There are
the
9
second
states in the second wave.
Calling it the second wave. For our viewers out there, how concerned are we that temperatures are dropping and it's flu season and we're headed for a second wave?
How did you know I wanted to answer this?
Well, Germany and those countries that are north of us
I think it was
now,
about Thursday.
where it's cold, are finding exactly that, aren't they?
I think it's about Thursday. They did a report on second wave, and you ought to see my notebooks at the house. I keep one available. I'm going to tell you
'Cause I went off on it, yeah.
what many people don't know. Every time I watch the media, I keep a notebook available, and I write their one-liners down. So about Thursday, when they went into second wave, I wrote down, "Must ask Ray."
Well,
Dr.
they've
Tibbett.
got some really good graphs on England, Italy, and Sweden, and one of the other European countries. Their quote second wave, positive
Right.
cases,
Right.
okay, finding the virus in people's throats, spiking way up there, okay. Hospitalizations and deaths not
Done.
following that curve.
All right.
Okay.
Okay, here's your graph.
Right,
All right, now you'll remember that this number of positive tests per day
right.
was at 18, 16, 12.
Exactly.
It got down to 5 a few weeks ago. Last week it was 12. So if it was 5 a few weeks ago and it went to 12 in positive tests, technically that's a wave. But as I've tried to say repeatedly, it's got nothing to do with people being sick. It has to do with more centers opening up to get tested.
Absolutely.
And if you please focus attention, there's 2 groups of people about these tests. There's people who, as they say, you need to get everybody tested, but our capacity doesn't allow you to test everybody at once. So there's some people who are somewhat paranoid and they want to run in there about every 8 weeks. I am seeing out there patients who are sick, or they call in and say, my husband's got a fever, he's coughing, can I come to my appointment tomorrow? Well, he needs to be tested, has he? Well, no, he says he doesn't have COVID, he just has the flu and he won't be tested. So you got 2 types of people here. Some that should get tested that aren't going to go do it, and then people who are healthy that are getting tested. But every time you set up one of these test things where you're testing everybody in the high school or in the parking lot, you're going to get a whole bunch more tests. You're not going to have a whole bunch more sick people.
Brian, let me repeat what he said so we'll have emphasis on it, okay? In any study, if you selectively pick out the people that you want to study and you know that they have the thing that you want to look at and you go out there and look for it, you will find it, okay? So, it's not a random sampling. It has nothing to do with the beginning of this whole thing when we were picking up pretty random stuff. Now we are looking for the virus in high contact people. It has not, so the media can look at 3 numbers: positive cases, which is positive tests, not sick, hospitalizations, and deaths.
I like to call it positive tests, and I'll not call it a case until they get sick.
So let's call it right. We'll call it positive test.
Positive test. You're not taking it to a case until
No,
they're sick.
but the media does.
The media's calling it cases. So they can look at 3 graphs. Which one are they going to choose to look at? The 2 boring ones, which are staying flatline, or the one that's spiking up? What does Bill say? If it bleeds, it leads. Okay?
Right.
They're going to look at the graph that looks hysterical. They're not going to look at the graph of the deaths and the hospitalizations, which are really looking good.
Okay, well...
and by the way, Georgia, in today's New York Times, is listed as cases are low and going lower. And, we talked about the second wave all in the Midwest. Mississippi hadn't had a good day yet, but at least Georgia is listed this week as low and going lower, and 3 weeks ago it was red. Well, that's because, and I told you then, that was the week all the college kids went back and got tested, so you ended up with about 3,000 positive tests out of about every college in the country, in the state. So boom, you got a whole bunch of positive tests. You didn't have a bunch of sick people. You just had a whole bunch of college kids, and that turned our color from sort of yellow to sort of dark red. Well, now we're back to yellow and getting better.
Well, let me say this. Let me wrap this up, okay, for both of our doctors here that you watch every Friday morning that have been doing this for 6 months and an amazing job. You need to share these with your friends.
I've been doing it for 3 years.
COVID.
Oh, COVID, 6 months. Yeah, okay.
I don't know what I'm going to do with it. I heard somebody faintly said they didn't know either. Anyhow, but our doctors have been focusing on this, and what I want to get to is both of these amazing doctors, they have a different practice. They are both clearly up on a daily basis with this virus. This is what I stress is an amazing segment, because Dr. Whaley has some very, I'll say, close ties and has been following this with leading epidemiologists. Did I get that correct?
You did it great.
6 months ago I couldn't say epidemiologist, but I've had to practice. But Dr. Whaley has great information that we have been given to follow this on the scientific level. So if they say follow the science, we have obviously had somebody over here making sure they follow the science. Your practice is treating these patients.
Boots on the ground.
And reading everything that's printed on it every day.
Right. So your practice is treating them. So I want to go to your practice right now of treating. Are you concerned in your practice? Are you preparing for a second wave?
No. But what I've been saying at the end of every show, people need to go on with their lives. If you're high risk, you protect yourself. You do all the stuff we've talked about for the last 6 months. If you're high risk, protect yourself. If you're not, if you're in everyone else, you go on with your lives. And you do the smart things. If you're in public or around other people, wear the mask because you're reducing the viral inoculum. Okay? But everyone needs to get on with their lives. They need to get healthy. That we're social creatures. We have families to take care of. We have children and grandchildren to be with. Need to go on with their lives.
Now, my question to you, I got a direct one for you. Now, with your friendships and your epidemiologists and your practice, you have to know, because your patient's immune system,
Right.
so you have to be on top of this also, although you're not treating the day-to-day, your patients have the concerns.
Yeah. Well, we're getting them started.
Right, you are so in the loop with epidemiologists, especially one that I'm aware of. But what are they saying? Are they feeling that we're getting a handle on this? We're going the right direction on a vaccine. We're going the right direction on treatment. We're going the right direction on how to handle this. How do you think they feel?
Well, first I'll say without a doubt, one, they do not believe that the healthcare professionals have lied to anybody.
Okay.
Two, they believe that people pick the data that they want to use, as Ray says, and make politics out of it. I was shocked, stunned, and amazed at the advances that they are making in the tests. I will just say this briefly. There is a test that will be available relatively shortly when you test a person with a respiratory symptom, which is who we're testing now. That will test, and it will tell you first of all, you don't have COVID, you don't have influenza, but it's going to test 36 respiratory viruses. And it'll tell you this patient has arbovirus 2, or this patient has influenza A1. So that one single test will be testing you for all known respiratory viruses. That's
fabulous.
When you hit the ER and you're sick, they'll know immediately what you've got and which direction you should go on. So it's not just you've got the virus or you don't have the virus, it's what virus you've got. Then secondly, they've got viral tests that are going to tell you you've got small, medium, or large. That's going to give you viral load data. Now that's not going to be available in a year or two. That's going to be available in a few weeks or months. So the advances that are being made there, I think the place that I wanted to speak a little bit today, and I'll just briefly mention this, is that when you are really bad sick, and we've had people up here that are very high profile that have been on ventilators, we know we have got stuff like you would have heard the extracorporeal people, kind of like the artificial heart, people that have been dragged back from the pit by this great technology. It makes huge headlines. Been 1,000 patients, for crying in the night, that have had that done out of these millions that have had the disease. Let's focus on the great unwashed out here. Everything that's going on to the average guy is in the proper direction, and even those very few that end up on a ventilator in the ICU, all the treatments are getting increasingly better, so that you have a very good chance of surviving an ICU hospitalization with a ventilator tonight.
I will tell you this, and I always say this, and I know both of you understand where I'm coming from because you know me and you know the history with my family dealing with this personally. And I will never forget when this very first blew up in March. I mean, it just started running rampant. My sister would call me. My dad was in the hospital. He had tested positive for COVID. And she would call me and she'd say, I just got off the phone with the doctor. And I don't want this taken wrong. I just got off the phone with the doctor. And she would say, Brian, I really get the feeling they don't know what to do about this.
And they didn't.
They do now.
But you see what I'm saying?
Yeah, but they do
you know
now.
What I mean?
But they don't.
That's big. We've gone from there to.
Let me harp on what Bill just said there. It's not a harp, because I've been looking at this test. In the world of infectious disease, this is the EKG to cardiologist. Okay, heretofore, we've been having arguments about whether you treat a sore throat like it's strep or not, and are we over-treating with antibiotics. This set of tests that Bill's talking about, you'll have a patient come in with flu-like illness, okay, FLI, and you'll test them, and not only will you know which virus or bacteria, you'll know how intense it is, and it will give you a band of antibiotics that work or don't work, or antivirals that work or don't work. The physician will have in his hands within 15 minutes to half an hour the precise cause of that illness in that patient's respiratory tract. That's phenomenal. I mean, it's just phenomenal.
It's like a cardiac catheterization
All right,
versus an EKG.
There's two things I know they, I hope so, I know they at home want to know. There's two things that we want to know, and I've got to get them out. Now, we try to, I'll look at the camera, we try to make sure in this segment we separate, anything political. We try to make sure. But you and I out here on a daily basis, we have this loudspeaker in our ear, the media. And it is a loudspeaker trying to project what they think the information. So I'm going to ask you directly, okay? I want both of you to answer. Don't wait till I get done. The federal government, this is what we hear. The federal government has no response. If they would responded, if the federal government would have had a plan, we would be here, here, and here. Now, what I think is the federal government did have a plan. You can't have these tests if you don't cut red tape out of the way. You can't have the vaccine. Did the federal government really actually have a plan, and have they been a help in rapidly getting this going? Both of you.
I'll give you as dumb an answer as this whole notion is that we've not done a good job. If I increase your Haldol dose, those voices will go out of your head.
Okay. I don't have voices. Okay.
Just kidding.
No, there's an old thing they call it touche. Okay, I'll take it. Get rid of the voices in your head.
Yeah, we got to get rid of those voices. But
you understand what I'm saying?
No, just all kidding aside, we've done a fabulous job in this country, an incredibly fabulous job.
What say you on that?
Go back to the Civil War. You got to learn from history. The battlefield changes. And when it changes, you got to change direction. And the battlefield in January, and the battlefield in March, and the battlefield in June were all different. And how they approached things, how much data they had, what works and what doesn't work is a moving target. We absolutely know for an absolute fact the COVID virus is infectious. COVID virus can be diminished by quarantining the ill, protecting the elderly, and those of us out here who wear our mask, wash our hands, and social distance will be less likely to get it and die. So I think we've done a beautiful job, and the government has cut the red tape out of this blinking vaccine manufacturer, and they've done in 3 months, which would have been what would have been 3 years. They did the same thing in building the ventilators, and they went way beyond what was necessary because they really did have a plan. When they set up all of these doomsday hospitals that never got used, that wasn't a waste of money. That was just planning that they hoped they never used, and they didn't, and there's nobody should be criticized for that either.
Plan for the worst, hope for the best.
That's correct.
All right, one more thing, okay? Again, not trying to mix the politics in, but watching our debate with two people that want to be the next president of the United States, one to continue, one to be the next. President Trump made a statement. We don't really know the number of deaths in China and Moscow.
We don't.
We don't?
No.
We don't?
No.
Okay.
No. I don't think we know that.
I
think we know the number of deaths in England and Germany,
right,
and these Western countries. We didn't know. As a matter of fact, remember the Italians had to go back and redo their deaths. They had to add a whole bunch at the end. But I think in this country has the best monitoring system in the world.
But when some of those voices in my head continue to tell me, thank you, that's going to go a long way, continue to tell me that, you know, America on this world stage and our death rate, we'll never know in China and Russia right now today.
Anybody who says that we have done a bad job is ill-informed or malicious.
Okay, your last word of the day?
That's
I liked that, ill-informed and malicious. That was very good.
You got something, sir? I got
I want you to go to school. I want you to play your ball games. I want you to go to the restaurants that are 6 foot apart and where the people are wearing masks. And if a kid on the football team gets the virus, send him home. Don't cancel the game and let the second string quarterback play in his place. Live your life. And if you're over 65 years old and you're overweight, stay home and protect yourself, and then let your family in there if you know that they aren't sick. But otherwise, we got to keep on going. And donate blood.
I want you to go to the apple orchard this weekend up here in North Georgia. It's October, and generally we would be preparing for tomorrow, the first week of the Apple Festival, but we won't be this year. But we want to let you know while we're talking, and he says you want to do this and do that. We want you to get outside this weekend, enjoy it. We want you to go to all the apple orchards. I want you to go to the pumpkin patch, get your pumpkin, go home, make a jack-o'-lantern. Is that what you're supposed to do with the kids? Nice project with the kids. I want you to do that. I want you to get the pumpkin seeds out, dry them, bake them with a little salt. Maybe I'm going back a couple years, what we used to do. But isn't that a nice, fun family activity?
I only let my wife call me Pumpkin.
Cut pumpkins with your pumpkins with your grandkids.
We're not going to have a joke of the day because he has jokes today. Dr. Tidman does. Share these segments. The President of the United States is okay. It is a concern. Relax all the alarm bells that the media are putting off and highlighting and the volume level that they're sending you that the president has tested positive. Share this segment with your family and friends. You can go to FYNTV.com, click on Ask the Doc for the daily segment here. Go to our YouTube channel, the playlist, Ask the Doc on FYNTV, Fetch Your News. Share it with your family and friends. And again, thank you, North Georgia Cancer Research, affiliated with Northside Hospital, for this segment.
And we did answer your question, but we scattered through the whole day.
Well, President has changed the news of the day once again. We'll be back with the All-Star Political Panel. Thank you guys so much for clarifying so many things this morning right after this message.